Susan, thank you so much for taking the time with me today. I'm excited to dive into what Savor Health's doing.
I'm excited to be here. It's kind of fun to be in person with human beings after 2 years of being locked up.
It is very, very nice. So Savor Health is taking a novel approach to caring for cancer patients with this better understanding of nutrition. So unpack that for me.
Sure. So what we're doing is using nutrition as an interventional lever to prevent and manage the symptoms of cancer and cancer treatment. So I like to say, let's add a carrot to the scalpel that we might be using, and let's have 1 + 1 = 3 by using nutrition to enhance the treatment and to manage the symptoms of cancer. Because I think it's fair to say 100% of cancer patients have symptoms of their treatment and of the cancer itself. And what people don't know is that nutrition as an interventional lever can actually mitigate those symptoms, prevent those symptoms. And what does that do for the patient? Well, it keeps them on therapy, it helps them live longer, and it keeps them out of the hospital or the emergency room.
Can you give us a specific example of how nutrition plays into cancer treatment or recovery?
Sure. So 58% of Medicare patients that are on chemotherapy go to the emergency room at least once in a year. 63% of those end up being subsequently admitted to the hospital, and this is due in probably the largest reason why patients are ending up in the ERs, chemotherapy-induced nausea, vomiting, or dehydration. If those two problems are addressed early, identified early and then intervened through nutritional means, we can keep them out of the hospital, we can keep them out of the emergency room, and have that symptom profile be much less severe.
And how does food play into that, just at a real practical level?
At a practical level, it's what are foods that can help me not feel so nauseous, or what are foods that won't irritate my mouth sores. So what does that do? Well, first of all, it's not as painful for the patients, but number two is it enables them to eat. And when you're going through cancer treatment, you need to have as strong of an immune system as possible, and part of the way you do that is by eating healthfully. But if your mouth hurts and you can't eat, you're going to lose weight, and you're also not going to be building your immune system.
Okay, so now let's break down the Savor Health platform. How do you communicate that vital information to a cancer patient?
So what we do is we have a virtual dietitian-on-demand named INA, which is an acronym for Intelligent Nutrition Assistant. And what INA does is provides both query response and push guidance that's personalized to the patient's specific cancer, their cancer treatment, the side effects that they're experiencing at that point in time, but also their underlying comorbidities, their height, their weight for a BMI. So we look at the cancer as the primary, but also we solve for those underlying comorbidities. And then we also look at what does the patient want to eat, any sort of preferences, allergies, etc. So, for example, if a patient said, give me a recipe or tell me foods that I can eat that won't irritate the mouth sores, we would first look for what are those foods that won't irritate the mouth sores, and then we would kind of solve for those other preferences. And you may think, well, why is that? Well, the why is that it's not sufficient to just solve for the medical needs of the patient. What we really need to do is look at their context. What matters to them? What do they want to eat? Because it makes it more understandable, actionable, and kind of relevant to their situation. So what we try to do is engage them on things that matter to them and that they're experiencing. And I think in cancer, it's really important to know that you could start out on a specific therapy and have mouth sores, but over time you could develop nausea, vomiting, diarrhea, constipation. So that side effect profile changes over time. And so that ongoing outreach that INA does via SMS text is a way to stay on top of what is really happening with the patient at every point in that journey. And then based on that, customize the advice to help the patient in the best manner possible.
So if I'm hearing you, so if I'm a cancer patient and I'm really struggling with what I want to eat, I've got some issues, maybe mouth sores or headaches or nausea, I'll text right into the chatbot and say, and have a question about, I'd like to eat this, but this is an issue. And it's just, is it free text? I can just...
It's free text. The initial intake form has some structured data forms to kind of build the patient profile.
Sure.
But from that point forward, it's, hey, Ina, can you give me a recipe could you tell me what foods I can eat?
And not just what I can eat, but also, you said preferences. So I really like X. I really like this kind of food, and kind of combining that information.
Right, exactly.
What is that preference data? It just makes me think about the importance of the patient's mental health and their well-being, as that contributes to their resilience and their immune system.
Well, absolutely. And so one of the things we learned, we were in the medically tailored meal delivery business. One of the things we learned was that meal delivery signified a loss of independence and a loss of control. And 98% of patients told us what they really wanted was to be empowered with information and resources that gave them back control, allowed them to remain independent, and basically have agency in their treatment journey. So what does that do from a quality of life perspective? We're empowering patients with personalized nutritional guidance so that they can self-manage their symptoms. And when you're diagnosed with cancer, everything in your world spins out of control. You just do what the doctors tell you to do. Food and nutrition is something that you can control, and if you know what to eat, it is an incredibly empowering feeling, but also it can improve your outcome.
As you know, there's a lot of tools and technologies out there kind of trying to tell people what to eat. A lot of them aren't validated. How important has it been for you to clinically validate the kind of nutrition advice that you give to cancer patients?
I think it's critical, because I think we're at a point in time where the industry is actually looking at other levers to improve outcomes and reduce cost. And it's a healthcare business, so we need to validate it. So we look at nutrition the way a drug company looks at a small molecule. We start with the evidence, we rely on the experts, we provide it into the market, we evaluate what happens, we validate it. And so we take a very long-term data-driven approach that's all about validation, because as you know, my long game is I want to see evidence-based nutrition, a reimbursed standard of care incorporated into the treatment guidelines. And the only way we'll get there is by being very methodical, scientific, rigorous in what we do, and validating everything that we do.
Which aligns very well with the fact that you've got a direct line of communication with your users via text. You're gathering all of that data.
Yeah.
What are you excited about what's next for Savor?
Two things. So one is the validation studies, because we're gonna have those by the end of the year in specific areas.
Awesome.
The second is we're launching in kidney disease, and so we're launching a second vertical this year.
Awesome. Susan, thank you so much for taking the time with me. I'm excited about the way that you're really reaching some folks that have maybe suffered in silence. Not only do they have cancer, but they're dealing with nausea and vomiting, whatever their diet is restricting them, and you're giving them new life. And so just appreciate that work. So thank you.
Oh, you're welcome. It's a pleasure, and every day I wake up and feel very, very lucky that I can help these patients.
Wonderful. Thanks, Susan.
Thanks.